We are still seeing a ton of influenza. The numbers in my county actually looked like we'd peaked and we were trending back down, but then they started back upwards again. A lot of people asked on my last video if the people I'm seeing with influenza were vaccinated, and the vast majority, 95% or more, are not vaccinated. But there's kind of an asterisk there because this is not everyone with the flu. This is the people in my area in Florida who are coming to the emergency department with the flu are vastly not vaccinated. I haven't had a single admission for influenza who was vaccinated. It's difficult to tell if the vaccine is effective or not because none of my patients are vaccinated for it. A lot of questions about Tamiflu as well. This is not a perfect medication, but it does decrease the severity and the duration of influenza, especially when it's given in the first 48 hours. We absolutely give Tamiflu to kids because kids are in a high-risk group for complications with influenza. Probably the most common side effect that we see with Tamiflu is vomiting and diarrhea, and that risk has been documented at about 10%. However, I think that risk is probably quite a bit higher. It is also pretty common to have vomiting and diarrhea with influenza itself, especially for kids. I think the side effect that people get concerned about with Tamiflu is these kind of weird neurologic symptoms that can develop. I've seen it documented at 1% or less of people who take it, and you can have hallucinations, some abnormal movements like chorea, and then you can have seizures. Again, this is a low percentage, but it is possible with Tamiflu. It's really important to understand the risks and benefits of taking medication, and so I have a little spiel that I give my patients when I prescribe the Tamiflu, and I give them kind of the option to take it or not, but make sure that they understand the risks. There have been 27 pediatric deaths so far this year, and historically, about half of the kids who pass away don't have any significant past medical history, so please take the flu seriously, even for normal, healthy kiddos and adults.